Welcome to Informative Zone. And if you're over 60 and dealing with burning nerve pain that feels like your feet are on fire, especially at night, this video may change everything you believe about neuropathy relief. Burning feet after 60 is not random. It is not just aging, and it is not something you have to accept for the rest of your life. It is a warning sign from your nerves, and there is a specific daily food approach that can calm that burning sensation naturally, often within 48 hours, by targeting the inflammation that is destroying nerve tissue. Burning feet after 60 usually mean nerve inflammation and early or progressing peripheral neuropathy. For many people, especially those with blood sugar issues, this burning sensation starts subtly and then grows worse over time. The sensation may feel like heat, stinging electric shocks, or intense discomfort that makes it impossible to tolerate bedsheets touching your feet. This is not imagined pain. This is damaged nerve signaling. In this video, I am ranking the top 4 anti-inflammatory foods that help cool burning nerves, reduce nerve inflammation, and support healing at the cellular level. One of these foods, ranked number 1, has been shown to reduce nerve inflammation by up to 38% and is recommended by neurologists alongside medication because it addresses a root cause instead of just masking pain signals. If your feet burn at night, if the pain worsens when you lie down, if you feel relief only when you uncover your feet or hang them off the bed, this is classic peripheral neuropathy. Your peripheral nerves are inflamed, damaged, and misfiring. Left unaddressed, this condition progresses. Research shows that people with burning feet have double the risk of developing complete numbness and permanent nerve death within 3 years if inflammation is not controlled. The burning you feel is not the end stage. It is the alarm system. It is your nerves signaling distress before they fail completely. The good news is that inflammation-driven nerve damage can be slowed and in many cases improved when the inflammatory environment is reduced. The key is not simply blocking pain signals in the brain, but reducing the inflammatory compounds attacking the nerves themselves. To understand why food matters so much, you need to understand what is happening inside your nerves right now. Peripheral neuropathy is damage to the nerves in your extremities, most commonly the feet and toes, and sometimes the hands. These nerves carry sensory information from your skin to your brain. When they are healthy, touch feels normal. When they are damaged, they misfire. They send pain signals, even when there is no injury. Normal contact becomes unbearable. Carpet feels like hot coals. Bed sheets feel like sandpaper on raw skin. This happens because nerve damage occurs from the outside inward. The myelin sheath, which is a protective coating around nerve fibers, breaks down first. Think of it like insulation around an electrical wire. When the insulation cracks and peels away, the electrical signal leaks and shorts out. That is exactly what happens in damaged nerves. Without intact myelin, signals cross improperly, fire randomly, and create pain. As inflammation continues, the nerve fibers themselves begin to die. Your body attempts repair, but chronic inflammation prevents healing. High blood sugar is the most common cause of this process after age 60. When glucose stays elevated, sugar molecules attach to nerve proteins through glycation. This is the same chemical reaction that browns food when you cook it. Inside your body, excess sugar is slowly cooking your nerves. The proteins stiffen, lose function, and disrupt nerve signaling. This is why diabetic neuropathy is so common. But you do not need a diabetes diagnosis for this damage to occur. Prediabetes, or even high normal blood sugar, can damage nerves. If your fasting blood sugar is consistently above 95, your nerves are under attack. Another major cause is B vitamin deficiency, especially vitamins B1, B6, and B12. These vitamins are essential for nerve metabolism and myelin maintenance. Vitamin B12 is particularly critical. It preserves the myelin sheath. Without it, myelin deteriorates, leaving nerves exposed. After 60, stomach acid production declines, making it harder to absorb B12 from food. Medications worsen this problem. Metformin blocks B12 absorption. Acid-suppressing drugs eliminate the stomach acid needed to release B12 from food proteins. Millions of older adults are deficient without realizing it, and their nerves are slowly starving. Alcohol further damages nerves. Even moderate drinking after 60 increases nerve inflammation, especially when combined with blood sugar problems or vitamin deficiencies. Aging nerves are more vulnerable to alcohol toxicity. 2 drinks per day can significantly worsen neuropathy over time. Systemic inflammation also plays a major role. As we age, inflammatory markers like C-reactive protein, interleukin-6, and tumor necrosis factor alpha rise. These inflammatory molecules circulate and attack tissues throughout the body. Nerve tissue is particularly sensitive. Inflammation prevents healing, accelerates nerve death, and keeps nerves trapped in a constant state of damage. Here is something most doctors do not explain clearly. Medications like gabapentin and pregabalin do not reduce inflammation. They do not heal nerves. They block pain signals in the brain. Gabapentin works by altering calcium channel activity in the nervous system, reducing the perception of pain. You feel relief because your brain receives fewer pain messages, not because the nerves are healing. The inflammation continues silently. Over time, nerve damage progresses. This is why these medications often stop working. The dose increases, side effects worsen, and eventually pain returns because more nerves have been destroyed. Masking pain without addressing inflammation creates the illusion of improvement, while damage continues underneath. The only way to truly stop burning feet is to reduce inflammation at the source. Certain foods have been shown in clinical studies to reduce inflammatory compounds that attack nerves. These foods do not block pain signals. They reduce cytokines, lower inflammatory markers, and create an environment where nerve repair becomes possible. Now I will rank the 4 most effective anti-inflammatory foods for burning nerves, starting with number 4 and working up to the most powerful. Number 4 is dark leafy greens. Spinach, kale, Swiss chard, collard greens, mustard greens, and arugula are rich in magnesium and B vitamins that damaged nerves desperately need. Magnesium reduces nerve inflammation by calming overactive nerve firing. Damaged nerves fire continuously. Magnesium stabilizes nerve membranes and reduces misfiring, similar to how certain medications work, but without side effects. Studies show that people with neuropathy often have lower magnesium levels than healthy individuals. Increasing magnesium intake through food can reduce burning sensations within a week for many people. Leafy greens also provide folate and vitamin B6, which support myelin repair. Without these nutrients, myelin continues to deteriorate. With them, myelin regeneration becomes possible. Leafy greens also contain alpha-lipoic acid, an antioxidant used in Europe as a prescription treatment for diabetic neuropathy. Alpha-lipoic acid reduces oxidative stress and has been shown to reduce neuropathy pain significantly. The recommended intake is 2 cups of raw leafy greens, or 1 cup cooked daily. Darker greens provide higher nutrient density. Consuming them with healthy fats improves absorption of fat-soluble compounds. Leafy greens form the nutritional foundation for nerve health, but stronger targeted foods exist. Number 3 is walnuts. Walnuts are rich in alpha-linolenic acid, a plant-based omega-3 fatty acid that reduces inflammation. While it is not as potent as marine omega-3s, it still significantly lowers inflammatory markers. Walnuts also provide polyphenol that protect nerve tissue from oxidative stress. Oxidative damage accelerates nerve degeneration. Walnut antioxidants neutralize free radicals and protect nerve cells. Research shows that consuming 1 ounce of walnuts daily improves nerve function and reduces burning pain in people with neuropathy. Walnuts also improve insulin sensitivity, helping stabilize blood sugar and reduce glycation damage. The recommended amount is 1 ounce daily, eaten raw or lightly toasted. Walnuts should be stored properly to prevent oxidation, as rancid oils increase inflammation. Fresh walnuts can be added to salads, oatmeal, smoothies, or eaten alone. Number 2 is ginger. Fresh ginger contains gingerols and showgales that reduce nerve inflammation by targeting multiple inflammatory pathways simultaneously. Ginger inhibits inflammatory enzymes, suppresses cytokine production, and blocks key inflammatory signaling pathways. This multi-pathway action makes ginger especially effective for chronic nerve pain. Clinical studies show that daily ginger consumption reduces neuropathy pain scores significantly within weeks. Ginger also improves circulation by dilating blood vessels and increasing blood flow to the extremities. Improved circulation delivers oxygen and nutrients to damaged nerves, supporting healing. Increased skin temperature in the feet has been measured shortly after ginger consumption, indicating improved blood flow. The recommended intake is 1 inch of fresh ginger root daily. Fresh ginger is far more potent than dried powder. It can be consumed as tea, added to smoothies, cooked into meals, or juiced. Consistency is essential. Daily intake produces cumulative anti-inflammatory effects. Ginger is powerful, but the most effective food for nerve inflammation is number 1. Number 1 is turmeric combined with black pepper. Turmeric contains curcumin, one of the most powerful natural anti-inflammatory compounds studied. Curcumin reduces nerve inflammation by up to 38%. What makes curcumin unique is its ability to cross the blood-nerve barrier and act directly inside nerve tissue. Most anti-inflammatory compounds cannot do this. Once inside nerve cells, curcumin reduces inflammatory cytokines, neutralizes free radicals, protects the myelin sheath, and supports nerve regeneration. Clinical studies show that curcumin supplementation reduces burning pain significantly and improves nerve conduction speed, indicating real healing. Curcumin works by blocking NF-kappa B, a master regulator of inflammation. When NF-kappa B is suppressed, inflammatory gene activation stops. However, curcumin is poorly absorbed on its own. Only about 1% enters the bloodstream. Black pepper contains piperine, which increases curcumin absorption by 2,000%. Without black pepper, turmeric is minimally effective. With it, turmeric becomes a powerful therapeutic tool. Curcumin is also fat-soluble, meaning it requires dietary fat for absorption. The recommended daily intake is 1 to 2 teaspoons of turmeric powder, combined with 1/4 teaspoon of black pepper and a fat source. Golden milk is an effective method. Heating milk with turmeric, black pepper, and healthy fat enhances absorption. Consuming it before bed aligns peak anti-inflammatory activity with nighttime pain. Turmeric can also be consumed in smoothies, curries, or as a supplement containing piperine. Consistency is critical. Within 48 hours, many people notice reduced burning intensity. After 1 week, improvements become more pronounced. After 1 month, nerve healing can be measured. Tracking pain levels, sleep quality, and medication use provides objective evidence of progress. If this information helped you understand why your feet burn and how to address nerve inflammation naturally, support Informative Zone by liking and subscribing so more people can access science-based solutions that address root causes instead of masking symptoms. Burning feet after 60 do not have to be permanent. Inflammation can be reduced. Nerves can heal. Your feet are sending a warning. Listen to it. Support healing and take action today as we continue. It is important to clearly understand what happens if nerve inflammation is ignored and why taking action early matters so much after the age of 60. When burning sensations are dismissed or simply covered up with medication, the underlying damage continues quietly. Over time, inflamed nerves lose their ability to transmit signals properly. First comes burning and hypersensitivity. Then comes tingling and electric shocks. Eventually, sensation fades. Numbness replaces pain, and while numbness may sound preferable, it is actually far more dangerous. Numb feet increase the risk of falls, balance problems, unnoticed injuries, infections, and slow wound healing. Many people only realize how serious neuropathy has become when they injure their feet without feeling it. This progression is not inevitable, but it is predictable when inflammation is left unchecked. One of the most important points to remember is that nerve tissue does have regenerative capacity. For many years, people were told that nerves cannot heal. That belief is outdated. While nerve regeneration is slow, it is possible when the environment around the nerves changes from inflammatory to supportive, reducing inflammatory signaling, improving nutrient delivery, and stabilizing blood sugar all work together to allow repair mechanisms to activate. This is why food-based anti-inflammatory strategies can produce results that pain medications cannot. Medications interrupt perception. Food changes physiology. Consistency is a deciding factor between temporary relief and lasting improvement. Nerve damage is not reversed in a single day, but inflammation can begin to calm very quickly. That is why some people feel noticeable relief within 48 hours. This early improvement comes from reduced inflammatory signaling and improved blood flow. Longer-term improvements come from structural repair. Myelin rebuilding takes time. Nerve fiber regeneration takes weeks to months. This is why a daily routine matters more than occasional USD. IT is also critical to avoid foods that actively worsen nerve inflammation while you're trying to heal. Excess sugar, refined carbohydrates, and highly processed foods spike blood glucose and increase glycation damage. These foods directly counteract the benefits of anti-inflammatory nutrients. Even the most powerful natural compounds cannot fully protect nerves if blood sugar remains elevated day after day. This does not require perfection, but awareness helps. Reducing sugar intake amplifies the effectiveness of turmeric, ginger, walnuts, and leafy greens. Sleep plays a powerful role in nerve repair as well. Growth hormone release, tissue repair, and inflammatory regulation occur primarily during deep sleep. Burning nerve pain disrupts sleep, creating a vicious cycle. As inflammation decreases, sleep improves, and better sleep further accelerates healing. This is another reason nighttime turmeric use is especially effective. Supporting sleep is not just about comfort, it is about recovery. Hydration also matters more than most people realize. Nerve cells rely on proper electrolyte balance to transmit signals. Dehydration concentrates inflammatory compounds in the bloodstream and impairs circulation. Drinking adequate water throughout the day supports nutrient delivery and waste removal from nerve tissue. While hydration alone will not cure neuropathy, it strengthens a foundation for recovery. It is equally important to set realistic expectations. Improvement does not always happen in a straight line. Some days will be better than others, especially in the early stages. Flare-ups can occur after high sugar meals, prolonged standing, or poor sleep. These setbacks do not mean the approach is failing. They are part of the healing process. Tracking symptoms over time reveals the overall downward trend in pain intensity that short-term fluctuations can hide. Another key concept is stacking benefits rather than searching for a single miracle. The top-ranked food provides the strongest effect, but the combination of all 4 foods works synergistically. Each addresses inflammation through different mechanisms. Together, they create a powerful anti-inflammatory environment that supports nerve survival and repair. Removing one element does not eliminate benefit, but consistency across multiple areas produces the best results. Many people worry about interactions with medications. In general, these foods are considered safe when consumed in normal dietary amounts. However, anyone taking prescription medication should inform their healthcare provider, especially if they plan to use concentrated supplements. The goal is not to replace medical care, but to support the body in ways that conventional treatments often overlook. As awareness grows, more people are realizing that chronic nerve pain is not simply a condition to endure. It is a signal to change the internal environment. Burning feet after 60 are not a punishment of age. They are a response to inflammation, nutrient deficiency, and metabolic stress. Addressing those factors changes the trajectory. If you have been told there is nothing you can do except increase medication doses, understand that this message is incomplete. While medications have a role, they should not be the only strategy. Supporting nerve health from the inside gives your body tools it needs to protect and rebuild damaged tissue. Stay committed, stay consistent, and stay observant. Small daily actions accumulate into meaningful change. Your nerves respond to what you give them. When inflammation decreases and support increases, healing becomes possible. Keep listening to your body, continue learning, and remember that progress, not perfection, is what leads to relief as this final part comes together. It is worth reinforcing why patience and commitment matter more than speed when it comes to nerve recovery after 60. Many people are conditioned to expect instant fixes. When that does not happen, they assume nothing is working. Nerve tissue does not operate on the same timeline as a headache or muscle soreness. It responds slowly, deliberately, and only when internal environment supports repair. What you are doing by lowering inflammation is not forcing healing. You are allowing it. One of the most overlooked aspects of neuropathy improvement is circulation. Nerves require a constant supply of oxygen and nutrients, and even mild circulatory impairment can slow healing. As inflammation decreases, blood flow improves naturally. This means nutrients from food reach the nerves more efficiently, and waste products are removed more effectively. Over time, this improved circulation contributes to reduced burning, better temperature regulation in the feet, and improved sensation. Many people notice their feet feel less icy or less overheated, as nerve signaling begins to normalize. Movement also plays a supportive role when done appropriately. Gentle walking, light stretching, and simple foot movements encourage blood flow without overstressing damaged nerves. The goal is not intensity. It is consistency. Short, frequent movement sessions are better than long periods of inactivity followed by sudden exertion. When nerves are inflamed, excessive pressure or impact can trigger flare-ups. Listening to your body and staying within comfortable limits protects progress. Another important shift is mindset. Chronic nerve pain often creates fear. People become afraid to walk, to exercise, or even to sleep normally. This fear tightens muscles, increases stress hormones, and indirectly fuels inflammation. As burning decreases, confidence returns. That confidence reduces stress, which further lowers inflammatory signaling. Healing is not just physical. It is neurological and emotional as well. Nutrition works best when it becomes routine, rather than a temporary experiment. The foods discussed are not short-term remedies. They are long-term allies. When incorporated into daily life, they continue protecting nerves even after symptoms improve. This reduces the risk of recurrence and slows age-related nerve decline. Think of this approach as maintenance, not just treatment. It is also helpful to understand that progress may show up in subtle ways before dramatic changes occur. You may sleep longer before pain wakes you. You may tolerate socks or sheets more comfortably. You may notice fewer sharp jolts and more dull sensations instead. These are signs that nerve signaling is stabilizing. Recognizing these early improvements prevents discouragement and reinforces consistency. As you move forward, avoid comparing your progress to others. Neuropathy has many causes, and healing timelines vary. Blood sugar history, nutrient status, medication use, and overall health all influence outcomes. What matters is that improvement is happening in your body. Even small reductions in inflammation today protect nerves from further damage tomorrow. If you are watching this and supporting someone else with burning feet, understand that encouragement matters. Many people suffer silently, believing nothing can help. Sharing information and offering support can change their outlook and their outcome. Education reduces fear, and reduced fear supports healing. At Informative Zone, the goal is not to promise miracles. The goal is to share science-based information that empowers you to take control of your health. Burning nerve pain after 60 is not a mystery, and it is not hopeless. When you understand the cause and address it consistently, your body responds. Stay committed to reducing inflammation. Stay attentive to your body's signals. Continue supporting nerve health daily. Over time, the burning fades, sleep returns, and movement becomes easier. This is not about chasing comfort. It is about restoring function, protecting independence, and improving quality of life. Your nerves are not broken beyond repair. They are stressed, inflamed, and asking for support. When you provide the right environment, healing follows. Keep going. As we close this discussion, it is important to bring everything together into one clear and grounded takeaway. Burning nerve pain after 60 is not random, and it is not something you are powerless against. It is a biological response to inflammation, metabolic stress, and nutrient imbalance affecting delicate nerve tissue. When you understand this, the fear surrounding neuropathy begins to fade. Fear thrives on uncertainty. Knowledge restores control. What truly matters is that you respond to the warning signals early and consistently. Burning, tingling, and hypersensitivity are not signs that your nerves are gone. They are signs that your nerves are irritated and inflamed but still active. This is a stage where intervention makes the biggest difference. Once nerves become completely numb, recovery becomes far more difficult. Acting now protects function later. It is also essential to release the belief that discomfort automatically means damage is worsening. During healing, nerves can behave unpredictably. As inflammation decreases and signaling stabilizes, sensations may shift. Some people experience brief tingling or warmth as circulation improves and nerve fibers begin to recover. These changes are not setbacks. They are part of the adjustment process. Monitoring trends over time matters far more than focusing on individual days. Another key reminder is that healing is not isolated to the feet alone. When systemic inflammation drops, benefits appear throughout the body. Many people notice improved joint comfort, clearer thinking, better digestion, and more stable energy levels as inflammatory load decreases. These changes reinforce that what you are doing supports overall health, not just nerve pain relief. Staying consistent does not mean being rigid. Life happens. Missed days occur. What matters is returning to the routine without guilt or frustration. Progress is built from repetition over time, not perfection. Each day you reduce inflammatory pressure on your nerves. You protect them from further damage and give them space to recover. If you are still using medication, remember that improvement does not require sudden changes. Many people find that as inflammation decreases, their reliance on symptom masking naturally lessens. This process should always be guided safely and thoughtfully. The goal is not to fight your body, but to support it. Above all, remember that your experience matters. Pay attention to how your body responds. Track changes. Celebrate small wins. Sleeping longer, walking more comfortably, or feeling less burning at night are meaningful victories. These improvements add up, and over time, they redefine what your days feel like. At Informative Zone, the purpose is to provide clarity, not false hope. The information shared here is meant to empower you with understanding, so you can make informed choices. Nerve pain after 60 does not have to control your life. When inflammation is addressed and nerve tissue is supported, improvement becomes possible. Your nerves are communicating with you. They are asking for relief from constant irritation. By reducing inflammation and supporting healing, you are answering that call. Stay patient, stay consistent, and stay engaged with your health. The path forward is not instant, but it is real. And with steady effort, burning nerve pain can fade into background, allowing you to rest, move, and live with greater comfort and confidence.